Okay, good evening. So we're gonna start our lecture, Quantitative Abnormalities of Leukocytes. From the name itself, quantitative meaning number. So first, sugod ta sa neutrophils. Alright, so we have our normal values. Simple lang, increased neutrophils. So why is it catecholamine induced? Meaning pag catecholamine, it's dependent on your sympathetic nervous system, and if it's your sympathetic nervous system, then it means your emotions, no? Fight or flight, kumbaga. That's why pag suko kayo ka or anything, emotional turmoil or kananggikan kag suka, anything that activates the sympathetic arm of your autonomic nervous system, it will eventually lead to neutrophilia. Why is that? Because remember that you have your marginal population of your neutrophils. Katong sa kilid lang sa blood vessel. No? When you have sympathetic stimulation, what will happen is your blood vessels will constrict. Eventually, they liberate the neutrophils from your marginal pool, and then they will go into your circulating pool. That's why you will have a false increase on your neutrophils. Therefore, you have neutrophilia. Kana na siya, no? So, kana siya. So, but of course, neutrophils increase when there is bacterial infection or any type of inflammation because they are the reactants to your first acute inflammation, no? So, what I want you to understand here is we have lots of causes of neutrophilia: stress, exercise, so anything that can facilitate your sympathetic nervous system, no? Because your sympathetic nervous system is, of course, your adrenaline, fight or flight. So, even uremia, take note of this, and even smoking. Smoking is a perpetual inflammatory kanang response, no? Because smoking in general damages your body. So, mao na permanently activated imong neutrophils. Anything that can activate or cause inflammation, even in slightest, can increase your neutrophil count. So what is this leukemoid reaction? Leukemoid reaction, if greater than 50 na imong absolute neutrophil count, and there is now a shift to the left. Now there is a presence of your band cells and your metamyelocytes, no? So you have band cells and metamyelocytes in the bone, in the peripheral blood. So kana siya. Pag grabe jud kayo na siya na bacterial infection, you can also see your toxic granulation, which we will talk about later, and your Dole bodies. So how do you differentiate your leukemoid reaction with your chronic myeloid leukemia? CML basically increase tanang myeloid nimo ng mga lineage imo. So yeah, of course anemic siya. Ang imuhang basta leukemia, most of the time anemic jud siya kay the abnormal cells will replace the normal red blood cell population in the bone marrow because they compete, no? You can also see your pseudo-pelgriuet. So that's along with your chronic myeloid leukemia. So what you will see is an increase in your basophils also, no? Kana basophils and your eosinophils, like all lineages. Unlike your leukemoid, only your eosinophils and basophils are kanang normal lang sila, no? Unlike in your CML, increased po sila. And then the genetic abnormality is your T922, which is also what we call your Philadelphia chromosome, BCR-ABL. Okay, your leukoerythroblastic reaction. Sayon lang kayo, taas po imuhang neutrophils. At the same time, you will see red cell blast, no? So this is gihapon in response to severe infection. So you also see teardrop blood cells, no? So mo ni siya your leukoerythroblastic reaction, naka-nucleated RBCs and teardrop RBCs. At the same time, you have severe inflammation. You also inflammation secondary to infection. You also have severe anemia. That's why nagagawas na po og mga nucleated forms imong RBC. Okay? Next is neutropenia. So, mostly, imuhang neutropenia is caused by drugs, no? Mga tambal. Anything that will inhibit inflammation, mga anti-inflammatory drugs na to. And our chemotherapeutic drugs. Remember, your chemotherapeutic drugs, they don't care. They will just kill anything that reproduces or undergoes mitosis quickly. No, so your blood cells, your hematopoietic cells, they are quite kanang labile, kumbaga, no? They're fast in turning over. They have a rapid mitotic rate. That's why they are prime candidates for collateral damage with your chemotherapy, especially your kanang mga chemotherapy. Over here, asa ba to? Basta na siya din eh. Mga chemotherapy drugs. Ako to nakita. Anyway, even your antibiotics, analgesics, so anything that can inhibit inflammation in general will decrease your neutrophil count. No? So we also have your other, so non-drugs. No? So we also have your copper deficiency. And then we also have your tumor metastasis. That's now what we call your myelophthic anemia. Okay, and then we also have your malignancies. So a granulocytosis, wala kay neutrophils. No? Basically, a granulocytosis is a severe form of your neutropenia. So these are the reasons why. No? So, kana siya. So, for the most part, common yun na cause ng neutropenia nimo is kanang drug use. No? But it doesn't mean kanang dili naka-reactive. It just, especially with immunosuppressants, at the point of immunosuppression, no, or anti-inflammation to reduce inflammation. And remember, your neutrophils are your first responders to your inflammation. Okay, next, eosinophilia. So, balik ta sa eosinophils. What are eosinophils even? Bilog, dakong granules, na pula. So, they are increased with allergic reactions and, of course, parasitic infections. Remember, your eosinophils, they have what we call ilahang primary granules. We have your MBP, your major basic peptide, rich in alkaline ng mga amino acids, mga arginine, They insert this MBP into parasitic ova, killing the ova. But they have little effect to adults imong MBP. That's why, if daghan kag parasites na adult na, continue lang mag-increase imong eosinophils because they try to control it but they can't kill that parasite. It's too big na. So, what will happen now is, increase lang imong persistent increase with the eosinophils. Another thing is they have these enzymes, what we call histaminases, so, to taper or to modulate the effect of your histamine brought about by the degranulation of your basophils and your mast cells. So that's why they're also increased with allergic reactions. They try to counteract the effect of your basophils. Eosinophilia and basophilia, kanang magbubo na imong eosinophils o basophils, very hard to say kay ilahang normal value gamay to begin with. Okay, basophils. Taas imong basophils, one clue na siya dayon sa imong chronic myeloid leukemia. Okay, kana jud siya. The only reason why you're gonna see increased basophils is most probably increased proliferation in your chronic myeloid leukemia. Hypersensitivity in mga allergic rhinitis, not so much because when they degranulate, they basically die. So after they degranulate in allergic reactions, there's only a brief window you can see that there are lots of basophils, but eventually they will all die because nagsige na sila o kanang degranulate, mga matay na sila. You can't see them in the blood anymore. There's a window, no, but it's not a very big window. So kana siya. Next, monocytosis. Of course, pag magkakita na kag monocytosis, you will see now, you can see tuberculosis. So basically, any chronic inflammation, tuberculosis is a textbook type of chronic inflammation. So what I want you to C is your monocytosis, the first sign of recovery from myelosuppression, meaning bone marrow suppression of bone marrow suppression. So kana ha. So it can either be myelosuppression can be either be from kana chemotherapy or infections So if you can see monocytosis na, meaning your bone marrow is now goods na, it's on its way to recover. So kana siya more of chronic inflammation. Okay. Next is your monocytopenia. So mabubuo imong usually ang sa cause kay kanang may Epstein-Barr virus because they specifically target your monocytes, no? So eventually mag-produce og heterophil antibodies ang mga plus mga atypical B cells, no? They produce your heterophil antibodies against this Epstein-Barr virus. So monocytopenia is very common in Epstein-Barr virus, no? And in viral infections in general. And like with neutrophils, anything that can inhibit inflammation, thus manaog po din mo ang monocytes because more or less the big brother of your neutrophil is your monocyte, no? Because it will become a big boy macrophage. Okay, lymphocytes. So nag-vary siya. Mas daghan ang lymphocytes sa sa bata, no? So we have arbitrary age 7. Usually pag less than 7 mas taas ang lymphocytes, pag greater than 7 mas taas ng neutrophil. So mao na ang transition. So these are your lymphocytosis basically viral infections, no? Any viral infection most probably mataas pud imong lymphocytes. And apart from your viral infections, imuhang mga chronic na mga infection, no? Chronic or kanang mga non-specific ganit. Like example, your mycoplasma is a type of atypical na pneumonia. So ang mutirada na ang lymphocytes, no? Even your syphilis, their target is basically usually mga intracellular na mga pathogens. So that's why the viruses, katong mga intracellular bacteria. Okay? Of course, na po yung it's not the rule, it's just kanang general na what they follow, but strep ni mo masaka po. So, lymphocytopenia, of course, we talked about it, your severe combined immunodeficiency. But if it's acquired, automatic hunaog AIDS. Pag munaog ang lymphocyte, bata pa, new onset na munaog ang lymphocytes, think of AIDS or HIV. Okay? So we now have your secondary morphologic changes. So during your infection, we talked about this ganiha. This is now your neutrophils. In your leukemioid reaction, we have now your toxic granulation. Your toxic granulation, mahimo ng coarse ang imuhang neutrophilic granules, no? Meaning there, ang mahitabo man gud ani, they didn't have time to make it mas pino, no? That's why coarse pa siya, meaning uptake siya gipagawas dayon siya sa bone marrow, wala pa na himong fine. That's the reason why toxic granulation. That's one of the reasons why. And mutaas po ilang acid kaning mucous substance, no? Acid mucous substance to enhance their bactericidal. So you can see this in your leukemioid reaction. Kanang they really they are kanang encountering a very strong bacterial infection. Next, we're gonna talk about your Dolly bodies. Your Dolly bodies are remnants of your ribosomal ribonucleic acid. So if your reticulin in your reticulocytes is like kanang characteristic for the immature cells, your Dolly bodies naman, they are associated in your WBCs, no? The immature, meaning wala pa na clear out ang mga ribosomal na mga inclusions. That's why they still appear. This is your Dolly body over here. Meaning it's just the same lang gihapon kanang ginapagawas dayon sa bone marrow ang mga neutrophils so that they will be part of the circulation because they have a kalaban na dako. So your Dolly bodies here, infection. So So remember that your granulocyte colony stimulating factor works the same way as your infection na gina-stimulate. Actually, pag naka-infection, taas po din mong GCSF, no? So meaning madaghan ang proliferation with your neutrophils or your granulocytes in general. And then mas faster ang turnaround time, meaning mas faster ang release sa imong mga neutrophils. That's why there's lesser time to mature. Therefore, magawa sila dayon. So, wala pa na-clear out ang mga RNA. You also have your cytoplasmic vacuoles. Ayun lang kaya ni siya. After nila phagocytosis, mabilin pa man itong mga vacuoles, no? But your cytoplasmic vacuoles, you can do it. It can be seen in neutrophils na gikan gani sa EDTA tube more than 2 hours. Nag-start na sila autophagocytosis, meaning ginakauna nila ilang self because they don't have food anymore. No? So you can see that's your autophagocytosis. So these are your vacuoles. If na po kay mga tambal na makakosog autophagocytosis, but kato. Then we have your pycnotic and necrotic cells. Basta nag-fragment na, dead na siya. Why do they die? Manilaog? Sige lang sila og. Remember that neutrophils, when they are sent to the battlefield, they are destined to die. So eventually, after they have reached their limit of phagocytosis, they will eventually die. So we also have your intracellular organism. You have your anaplasma phagocytophilum here in A. And you have your early Schaffenensis. So you have also your eosinophils in basophils. You have hypogranular. Reactive changes in monocytes are uncommon finding. So this is a reactive monocyte. So what does reactive mean? Reactive means a lot and nothing at the same time. No? So reactive can be a reaction to inflammation or kanang reaction to kanang infection. So a reactive meaning there is a stimulus and then the cell reacts to it. So in reactive monocytes, reactive lymphocytes, and reactive neutrophils, no, there will be changes. They are adapting. Especially you can see this clearly in the nucleus when there is changes in the nucleus because they are trying to encode new proteins to try to deal with the stimulus. That's why they react. So this is a monocyte. No, look at the contorted nucleus. It's trying to find the best gene to deal with the stimulus. No, or at the same time it's taking damage from the offending bacteria, offending agent. That's why reactive means a lot and at the same time it means nothing. So we really need to find out what it means. No. So if makita kag mga reactive term form, most probably there is a stimulus. That's what they react to. Okay? And that is all. Thank you. This is a very short topic. So if you have any questions, feel free to PM me lang. And God bless exam.